we can get started. Thank you, everyone. Thanks for those of you who are returning. Thank you for returning, and for those of you who are new, welcome to this afternoon session. As you, if you've been a part of the sessions throughout the whole day, we opened up with an opening prayer already this morning to set the stage, and we want to welcome everyone to our continued discussion in commemoration of the first ever National Day for Truth and Reconciliation. For several years, as you probably know, Alberta Health Services has been recognizing that every child matters by wearing orange and acknowledging the impacts of residential schools. This year, the federal government has declared September 30th as the National Day for Truth and Reconciliation. And today we are honoring this through a series of presentations. Today, or this afternoon, Dr. Esther Tailfeathers, Senior Medical Director for our Indigenous Wellness Corps, is here to talk about allyship, what that means for us as individuals and as part of the healthcare system, and how to move from allies to accomplices. Dr. Esther Tailfeathers was born and raised on the Blood Reserve in Southern Alberta. She graduated from the University of North Dakota School of Medicine and completed her family medicine residency in Edmonton at the University of Alberta. Esther has worked in many First Nations communities, including the Blackfeet Reservation in the emergency room, the Blood Reserve for almost 20 years, and has served the Northern Alberta community of Fort Chipewyan. Dr. Tailfeathers is currently the Senior Medical Director of Indigenous Wellness Corps, Alberta Health Services. Most recently, Dr. Tailfeathers worked with her community in response to the fentanyl crisis, which started in the fall of 2014. The opioid crisis and community strategies for harm reduction, treatment, and addressing upstream determinants of health in our home community has been the primary concentration of her work over the past 5 years. So with that, I'd like to turn it over to Dr. Tailfeathers, and thank you for joining us today.
Thank you, Marty. Okinitukwags. That means hello, all my relatives. So I'm really happy to be here today with you. I know it's a very difficult day, and we're all doing a lot of hard work emotionally, and we definitely are going to get to a better place by going through the work that we have to do. So before we begin, I want to acknowledge the content on racism and colonialism is a lived experience for many, and that if anyone is experiencing distress or pain as a result of this presentation, which may have triggered painful memories, please call the toll-free HOPE for Wellness line that you see the number at the bottom of this slide here. Our hope today is to come together as learners. And as aforementioned, for some, today's topics are lived experience. So I ask that we come with an open heart and that we walk lightly with each other. I ask that we enter our space with respect, humility, and trust. By this, I mean that we practice our ability to not only be aware of ourselves and our journey, our biases and or systemic biases, but to be aware of others and their experiences. It also means that we create space for each other, for respectful and reciprocal relationships where differences are acknowledged and where interactions and dialogue occur in safe ways. This is what we refer to as two-eyed seeing. So we acknowledge the truths of what's happened to the Indigenous people in our country, but also we acknowledge the work that is being done by our allies to lift us out of a place where we do not want to be anymore. So we see both ways. I also ask that we acknowledge that not everyone is starting from the same place and maybe at different points in their journey. Some may well be down their paths of allyship. Some may be just starting their journey. This process is not about becoming an expert in Indigenous people. This is not what makes a good ally. Rather, it is building an ethic of humility that says you cannot ever really know. There are some things that aren't yours to know. I also want to acknowledge that there may be feelings of unease and discomfort. These are your feelings to work through, but I would ask that you allow these feelings, your feelings, or of discomfort or unease to ground you. As a good friend and wise elder of mine, Narcissus Blood, who has passed away, when we had these discussions, he would always say hello to it and just be with it. It is not going to go away until we have met it and that we have allowed ourselves to just be with it. And that is what we are doing today. Next slide, Keenan, thanks. Hope, from ally to accomplice. On the screen and many of the slides are works by Indigenous artists from across Canada. We wanted to use art as a way of storytelling, as art is a powerful device that can generate reflection and understanding. And today across Alberta, there are many of our AHS frontline workers and clinics and people who are helping us to bring this education to patients and the Albertan population. And I just want to honor places like Elbow River Healing Lodge, who has used the outside spaces to bring Indigenous art and understanding to a lot of people who otherwise would not see it. Art is also a way to share stories of resistance and our own narratives. Next slide, please. Land acknowledgement. I acknowledge that I'm speaking today from my home community, Blood Tribe, in Treaty 7 territory. I also acknowledge that we are gathered virtually today on the territories of Treaty 6, Treaty 7, and Treaty 8, and Métis regions 1 through 6. These territories are home to many Indigenous peoples, including the Blackfoot, the Cree, Dene, Saulteaux, Ojibwe, Stoney Nakoda Sioux, and Tsuut'ina peoples, the Métis Nations of Alberta, and the 8 Métis settlements. We acknowledge and respect the treaties that were made in these territories, and recognizing that eliminating racism in healthcare is a crucial step on the path towards reconciliation. We dedicate ourselves to a collaborative partnership with Indigenous communities, guided by patience, understanding, and a commitment to reconciliation. Next slide, Tina. Reflections on territorial acknowledgements. I want to pause here and talk about territorial acknowledgements. I'm sure we have all been in meetings, or I hope we have, where time is taken to acknowledge the truth and the commitment to reconciliation. That is the heart of a territorial acknowledgement. By acknowledging the Indigenous peoples on whose territory we reside and work, we are challenging the erasure of Indigenous people. We are identifying the historic and contemporary role of Indigenous peoples on these lands. Our customs and traditions, such as land acknowledgement, show that we are here and our customs are alive. We are also acknowledging our individual and organizational responsibilities as good treaty partners. Please take time to acknowledge the traditional territory you live and work in. Take a moment to think about the relationship between your daily life and Indigenous peoples. Speak from your heart with these intentions for today to set the grounds for coming together in a good way. Next slide. A little bit about me. I think Marty said quite a bit in the beginning, so I'm going to skip reading all that stuff, and also share a little something about myself beyond my bio on the screen. I do need to share, and I think that many of us are in this position sometimes, that I am struggling with how far we must go to make things better for Indigenous people across the province. But I am lifted by my Indigenous colleagues who carry significant loads and moral injury, working to treat Indigenous patients with dignity and respect and find ways to bring better health outcomes to their patients. I am also lifted by my colleagues or allies who are non-Indigenous in our Indigenous Wellness Corps, our Indigenous ARP, our Provincial Medical Affairs, and people throughout the AHS who understand and support the actions that we are taking. I'm thankful for this allyship. Without it, we could not make the structural systemic changes that we are all working to change. Thank you. Next slide. Our hopes for today. When I think of hope in relation to the work I do as a physician in my community and to my life's work of achieving health equity with Indigenous peoples, I think of hope as being the opportunity where all Albertans can listen, understand, and hear the hard truths about what Indigenous people have been through and continue to go through due to colonization, racism, and dislocation from land and ways of knowing and being. It is my hope that Albertans can see the strengths our communities possess, our complex worldviews, Indigenous science, Indigenous legal and healing traditions, among other truths, the wisdom of Indigenous communities. I think of hope as being the ability to work together in collective action to change the very structures and systems that are oppressive and devastating for Indigenous peoples here in Alberta and across the world. These oppressive structures and systems are not easily seen and can easily be overlooked unintentionally. It is not like knowing where to, it is like not knowing where to begin, what questions to ask, let alone challenge these systems we cannot see. So today I hope we talk about allyship. I have heard many people ask, what can I do? How can I be an ally? What does being an ally mean? To take a look at these questions, I will break these into 3 points: answering the call, becoming an ally, and commitment to being an ongoing ally and accomplice. And in the Indigenous Wellness Core, accomplice means becoming a ninja. So next slide, please. So we do need to include people into this conversation. Keenan, did you want to speak to this?
Yes, we will have a few questions over the course of this presentation. So we would invite people to go to www.menti.com, MENTIA, and MENTI.com, my apologies, and enter the code in order to join this survey, 71421204.
So Keenan, do you want me to lead with the questions or do I hand it over to you with the questions?
I'll hand it over to you with the questions and then I'll call you for time, okay?
Okay, all right. So the first question, you might be wondering why I'm asking you to share something about yourself. The reason is relationships. So the question is, what is one thing people do not know about you? The reason is relationships. The heart of Indigenous health and of allyship is a commitment to a lifelong process of building trusting, consistent, and accountable relationships. Relationships are not the end goal, but rather the process towards the end goal, which is allyship. It's good to see all the comments being made here. We're making collective art.
And I want to honor these words. We'll probably give it 10 more seconds and then I'll move on to the next piece.
This is a beautiful picture of humanity. Thank you, everyone.
Thank you. And I'll move back to the slide now.
Answering the call. With the talk about reconciliation, there is much talk about decolonization. But before we start thinking about decolonization, we must think about colonization. As many elders remind us, truth must come before reconciliation. And that applies to Casey's very heartfelt and difficult truth, which we all have heard and which many of our people carry. So truth must come before reconciliation. Racism must be understood as something that is lived. It is experienced by individuals, families and communities, and nations through interactions and structures of our everyday world. We have to be conditioned to think about issues like racism as unwelcome. It is too sensitive. We need to decondition ourselves and learn from tough and sometimes awkward conversations, which helps us grow as human beings and as allies. Next page. We are all treaty people. This is something that my good friend Narcissus Blood used to always say, and it is very important that we recognize that it isn't just Indigenous people in Canada who are, or the First Nations who are treaty people. People who are non-Indigenous and all Canadians are part of the treaties. So we are all treaty people. We all have an obligation to those treaties and agreements that we made. And that's what makes up a good part of Canada. Many people think of treaty rights as special Indigenous rights. However, all people living in Canada are treaty people with their own sets of rights and responsibilities. Treaties are a foundational part of Canadian society. Every road, house, building, or business that exists today in a treaty area was made possible because of a treaty. But all the roads, houses, buildings, and businesses that exist in Canada off reservation exist because of our treaties. So the existence of treaties is proof that the first settlers of what now is Canada respected First Nations as sovereign people and negotiated with nation to nation. By understanding the colonial history of Canada, we can renew our relationships with each other and move towards meaningful reconciliation. There are many treaties in existence today, such as the Geneva Convention of 1949. We need to use language that brings treaties out of the past and make them a living, breathing document. Treaties may be historical, but they are not history, meaning they are not outdated as some of us would believe. It is important to reflect upon Inuit and Métis rights for land and resources and self-government with the same respect as treaties. Next page, Keenan. Colonization. We talk about reconciliation, or with talk about reconciliation, there is much talk about decolonization. But before we start thinking about decolonization, we must think about colonization. Colonization in Canada is actually best described as settler colonialism, which includes the added complexity that the colonizers settled here and did not go home. So it's not just about resource extraction, but the active dislocation of cultures and worldviews. It is important to understand that many people taking offense to being called settlers, even though the term is not derogatory, being a settler means that you are non-Indigenous and that you or your ancestors came and settled in a land that had been inhabited by Indigenous people. However, it is important to recognize that while the term is not derogatory, it can often be very difficult to hear, the same as people of our past would hear savage or Indian, and those were derogatory, but Indigenous is non-derogatory and settlers is non-derogatory. Colonialism has severely impacted Indigenous people, seen in land displacement, exploitation, adverse health outcomes, which is why we're all here today, inequities. It is also important to understand that colonization is not a legacy of the past. Colonization has been ongoing and continues today. Next slide, please, Keenan. Systemic racism, the roots. Structural racism essentially means that racism is baked into our systems and institutions. Dismantling racism then is not just about changing individual attitudes or simply putting specific individuals in key positions within current systems. Rather, it requires dismantling and reconstituting the systems that maintain racism and inequity. There are many opportunities to address systemic racism through policy review, changing hiring practices, ensuring Indigenous considerations are taken into account when building something new, like a hospital, considering and making room or spaces for Indigenous people to thrive, simply remembering to include Indigenous people at the beginning of any development, whether it be policy or governance, would challenge systemic racism. I just wanted to also add honorable mention and an example of how this is happening within AHS and across the province. I want to remember an event where our CEO, Verna Yu, and AHS responded to an occurrence on the blood reserve of racist comments made by an AHS employee. The response was a huge day of learning, and there were at least 200 AHS leaders, people that led digestive health or ICUs or emergency rooms, and many of our structures across AHS attended this gathering at the River Cree. This gathering was an apology for the event, but also the largest learning event for Indigenous health or Indigenous issues among AHS that I have ever attended. It was the largest blanket exercise in Alberta. What struck me was that afterwards, after the blanket exercise, we sat in learning circles or talking circles. And I don't remember the names of a lot of the people in the talking circle, but I do remember that one of the chief physicians in one of our ICUs said at that talking circle, "I will never allow my staff to refer to an Indigenous patient by their disease." So in many instances in hospitals and ICUs, an Indigenous patient is referred to by that COPD or that MI or that CVA. And he said, "I will never allow my staff to refer to them by diagnosis. I will make sure that they say the name of the patient." So I want to say that that was a significant turn in helping to educate and change the minds of our leadership. And that is where we begin to make structural changes. I also want to say that currently within each zone that there is discussions taking place by zone leaders. And I am very honored that they are opening their minds to the inclusion of Indigenous voices at their decision-making tables. And I think that is a significant structural and systemic change. And I thank those leaders for making that possible. The next page, Keenan. Systemic racism, the legacy. The legacy of these policies is a society where one social group has disproportionate access to power and resources in society, leading to avoidable and unfair inequities between these groups. Our systemic racism against Indigenous peoples, this imbalance of power and resources is maintained through inequitable treatment under the law and unfair policies, rules, and regulations. It is commonly manifested in social exclusion and isolation that limits or prevents political, social, and economic participation or access to and participation in social systems such as education and health. That is a statement made by the College of Physicians and Surgeons of Canada. Next slide, please. Colonization and systemic racism. Racism must be understood as something that is lived. It is experienced by individuals, families, and communities, and nations through interaction and structures of the everyday world. Understanding how colonization and systemic racism work will lead to more meaningful discussion. We must recognize that colonization and systemic racism are actually determinants of health for Indigenous people. Most of us who work within AHS recognize that Indigenous people do not access emergency rooms, hospitals, or clinics when they have experienced impactful racist events. And as a result, it's a deterrent to managing health outcomes on the upstream end of disease processes. and it does, and it may impact early death in the lives of Indigenous patients. Next page. Equality versus equity. Equity is the I don't see color stance, where we treat everyone equally and fail to make system changes to overcome embedded disadvantages Indigenous people face. For example, prior to COVID, there were many fire bans. To treat everyone equally, the fire ban included AHS, of course, without consideration that many Indigenous people sought spiritual care through a sweat lodge. The fire ban took effect over the sweat lodge, leaving many Indigenous people without much needed spiritual care. We need fire and heat to heat the special rocks for our ceremony. This is an example of systemic racism and treating everyone the same. Equity is accounting for those embedded inequities and taking active measures to overcome them. We need to also recognize that inequity shifts depending on context, and it is not experienced in the same way, and that inequity hits those of multiple oppressed Indigenous identities harder. And I just want to say that within populations, even within Indigenous populations, one of the most impactful or determinants of health is poverty. And I have seen that Indigenous people of greater privilege, those that have education and employment, are often even treated better than Indigenous people who are vulnerable, who have addictions or mental health issues. So that is what I'm stating in the context of how we treat people with equity or equality. Next page, please. Another Mentimeter slide. So I'm gonna ask this question and then I'm gonna hand it over to Keenan. What do I need to participate in an open and honest conversation about systemic racism?
For those individuals who still have the Mentimeter up, it should be good. So please enter it. If not, please refresh your page. For those who are new, the Menti website is up top, and the code once again is 71421202. Back to you, Esther.
It looks like we're getting another very nice piece of art. I'm hoping that we can keep these slides, because this is our collective energy and having to be in this truth, and now having to work towards reconciliation. I'll give you a few minutes, Keenan, for this to continue. I'm seeing vulnerability, humility, courage, knowledge, understanding, honesty, an open mind, willingness, safe space, opportunity. Some very good additions to this collective that we have.
Thank you, everybody. And these content we will be able to share, or we will be able to keep afterwards. Esther, I'm going to move back to the main slide now.
Okay. Becoming an ally. What is an ally? There is no one way to become an ally with Indigenous people. Allyship is active. It's not about claiming the title, but rather about doing the work. And I have to say that in the work that I've done with AHS, there are a lot of hardworking people who are working to understand what needs to be done in order to help Indigenous people and Indigenous patient outcomes. And I just have to give or say my gratitude for the allies that I see working frontline, the EMS people, the nurses, the doctors, even the housekeeping staff, who are starting to recognize this and show their allyship in the work that they do. Becoming or being an ally involves self-reflection, education, and listening, knowing we come into this space from a position of power and privilege. Move beyond reflection to change our own behaviors and challenge our systems of power. And I have to say that we are doing that right now, and it's a tough exercise, and that we do need allies to help us understand the system. I have to say this in the position that I have, that I've been very privileged to work with people who have been working with AHS and in leadership positions for a long time, recognizing how we have to collectively design processes and structures and systems so that we can continue to or redo, or that we have the same outcomes or better outcomes. And there are a lot of people working behind the scenes to change these systems of power. And I'm thankful for that. Bring a good heart and desire to learn. And when comfortable using your privilege, call out racism. For example, seeing an Indigenous person being harassed for walking the wrong way when multiple others are, ask yourself, why is the Indigenous person being singled out? The next slides dive deeper into the different ways to become and be better allies. Keenan? Listen. Listening is critical to being a good ally. It means becoming a better listener. We can do this by creating a safe environment through the active listening. We can begin by saying less. It sounds easy, but it can be harder than we think. We often want to talk and relate to experiences, but we need to decenter ourselves from the conversation and truly just listen. Next page, Keenan. Educate. As part of our learnings, we must acknowledge that as a non-BIPOC, we benefit from a system that affords us with more opportunity. It is important to do the work on your own first. Educate yourself. It's not the job of Indigenous people to teach all the time. Some Indigenous people are tired of constantly challenging systemic and overt racism. Here is an opportunity to use your education and give them an opportunity to sit back and recharge. I remember going to medical school and being challenged by my non-Indigenous class members. And while I was trying to learn, and I did struggle with chemistry and physics and everything else, while I was challenged to learn, I had classmates in my chemistry lab who were constantly asking me, why do your people have old cars sitting outside their house? Why are your people addicted to this? Why are your people alcoholics? And so I want to remind you that even in the learning situation, when an Indigenous learner is trying to learn what the non-Indigenous learner is, it is not their responsibility to teach the non-Indigenous student about Indigenous people. They're there to learn as well, and they're there to gain the knowledge that everybody else is. So I want to remind you that there's contexts when Indigenous people are challenged by the people around them in these situations. Thank you. Next slide. Amplify, don't overpower. Practicing allyship means that we are careful to avoid monopolizing, overtaking, or speaking for. And part of our work is to seek permission and consent from the Indigenous partners we seek to work with. This is it's becoming very much an active thing that we are listening more and more. And I know we have lots of listening to do to Indigenous communities at whatever level you're at, whether it be in the community, whether it be in the zone, whether it be in the province, that we begin to hear the voices of Indigenous patients across the province, because without listening and amplifying their voices, we will not be able to make the changes that we need to do. Next page. Speak out and amplify strength-based messages. Certainly, there are mountains of stories about the generational sufferings of Indigenous people in Canada. Understanding and honoring these stories is an important part of becoming an ally. But the flip side of that is participating in a kind of trauma exploitation. And sometimes I will refer to this, and I have been challenged, that there is something called social pornography. And sometimes the media is guilty of making sensational stories of something that happens within Indigenous communities, something horrible or awful, which becomes sensational. And I think that is trauma exploitation. Ultimately, focusing only on this aspect can contribute to a stigmatization of Indigenous people. It is so important to understand that Indigenous cultures, pre-contact and today are complex with established systems of governance, spirituality, health and wellness, humor, justice, science, family, and community relations. We have our leaders and our elders who lead and amplify our strengths. It is so important to be listening to the strength-based stories. And I think it's very important for our youth to hear the voice of amplified strength-based messages and to see themselves not as victims, but as people who can challenge and make changes to the system and make better lives for the people in their communities. The next page, please. Don't be a performative ally. The perfect ally does not exist, and mistakes will happen. Good allyship means you can be called out for your inaction in a way that creates opportunity to do better. Do not be defensive about your mistake. Good allyship means that you can be called out for your inaction in a way that creates opportunity to do better. But we must get out of the practice of shaming people into fear and encourage reflection and teachable moments. I think this is a very difficult place for both Indigenous and non-Indigenous people because we are new to this. I mean, there's been allies for hundreds of years, but sometimes allies will sit at tables creating events or addressing issues. And I think that this is where we need to use two-eyed seeing. I think that allies have been very helpful in bringing these events and these changes to the forefront. And as Indigenous people with two-eyed seeing, sometimes we're very critical of our allies, and it's really important to have respect and know that this is a growing process and that we all need to respect each other at those tables. So I think that our allies who work with us also need to be respected in two-eyed seeing, as we expect allies to respect Indigenous people as well. Don't be silent, use your platform. The work of an ally is not just understanding privilege, but to use it for good. Leverage your privilege to change the status quo. When injustice is
Excuse me, Dr. Tailfeathers, I think you've gone on mute.
Sorry, everyone. I think I'm reading. I'm sorry. Yes, so don't be silent. Use your platform. The work of an ally is not just understanding privilege, but to use it for good. Leverage your privilege to change the status quo. And in saying that, I remember always that ICU, chief of ICU, who uses and used his privilege to help make change for good. When you see injustice happening, call it out, whether it's in the world at large or in your organization, your family, and with friends. Calling out people in real life can and will be challenging. If you can't yet speak, recognize a fact and commit to doing your work so that one day soon you can. I always remember an elderly obstetrician gynecologist who told me a long time ago that that when we make these changes for other people, we are actually making these changes for ourselves, because we all belong to this community, whether it be our smaller communities or the provincial community at large. But making these changes makes a better place for ourselves. So it can be seen as making a place better for ourselves as well. Using your platform is about using your power to allow others to do the work they have always been doing without fear. It's about ceding power It is hard and uncomfortable, but this discomfort doesn't last forever. It can be a tool of empowerment for yourself, and it's wonderful to see others take the lead, and Indigenous people, and I don't like to use the word empowerment, but Indigenous people using their strength. Okay, so we're at a Mentimeter slide. The question is, what do I need to educate myself on? Go ahead.
This is our third and final question. I think we have it by now.
Great. There's lots of good comments coming up. Speaking up, TRC calls to action, listening, how to take action, my own biases, how to speak up, culture, traditions. I see repetitively TRC calls to action, how to speak up. Beautiful, beautiful.
I'll give it another few seconds, but there's a lot of great ideas here. Thank you, and back to the slides, Esther.
Okay, thank you. Commitment to being an ongoing ally. The work of an ally is not just understanding privilege, but to use it for good. Leverage your privilege to change the status quo. When you seek injustice, when you see injustice happening, call it out, whether it's in the world at large or in your organization, your family, and with friends. Calling out people in real life can be challenging. If you can't yet speak up, recognize the fact and commit to doing your work to do that. One day soon you can. Using your platform, about using your power. It's about ceding power. This is hard and uncomfortable, and I'm sure I already said this. I'm sorry, guys. I think this was in the previous slide. Okay, last slide, or second to the last slide. Move from ally to accomplice, or as we within the Provincial Indigenous Wellness Corps say, from accomplice to becoming a ninja. Thinking about allyship is a lifelong process. We can think of allyship as growth and evolution. We have talked about the commitments we will make as an ongoing ally. These commitments are our foundations for moving from ally to an accomplice. When we think about an accomplice or a ninja, we mean the work we do and how we shop up when there is risk. Being an accomplice means that we see the system not merely as broken, but as a system that is operating exactly as it was intended and works to dismantle its scaffolding piece by piece. We need to start seeing each other as human beings. Colonization and systemic racism have done an excellent job at having society view Indigenous people as less than, less worthy, and less human. When we become an accomplice, we see each other's minds, each other's dreams, and most importantly, each other's hearts. We stand shoulder to shoulder and make good trouble. Thank you for listening and learning. For those who may be new to allyship, and thank you to those who have been doing the work and who are standing shoulder to shoulder with us. Thank you.
Thank you, Esther.
Go ahead, Marty. Thank you.
Yeah, thanks, Esther. Thanks for sharing your words of wisdom, your experience, and your knowledge with us. I'd like to open it up. We do have some time for questions. So if there's no questions in the chat and you feel free to speak, you can, or you can pose a question in the chat and we can open it up for Esther to respond. Okay, I have a question then. What advice do you give people who want to do their best as an ally, but are afraid to make mistakes and or do make a mistake or that they see as a mistake? And how do you encourage them to stay on the path?
I think I think your last few words were exactly what we do. Is we need to encourage them to stay on the path. We need to support allies when they feel that they're, that they need that support. And like I said earlier, the two-eyed seeing is very important. It's very important for Indigenous people as well. And I know and see it. I see it in people like Casey and Wally with our Wisdom Council and a number of our Wisdom Council members who will correct somebody, but bring them back to the table or bring them back into the circle. So I think that it's a lot of hard work for all of us, but we cannot drop anybody from this circle. We need to continue.
Keep the circle strong.
Mm.
There was a question, I think, for clarity. What was the name for the ally that was more appearance than substance?
I don't know. I mean, I don't think that there is one ally that's more appearance than substance. I mean, I have seen people attend rallies, but and be very vocal at rallies, but you don't see them active in actually, helping out when when help is needed.
Okay, there is a question from Caroline.
Yeah, I've gotten a couple that have come in. I'm wondering, how do you know if your actions are helpful or not helpful? And who can you ask for some advice on that?
We do have, like within the Indigenous Wellness Corps, we have cultural liaisons in the hospitals and other service areas within AHS. I think it would be very nice to reach out to them. We do have a number of our senior advisors as well in each of the zones, which if you are in the zone are easy to access. And if anything, Marty would be able to direct you to anyone within your zone that can help you with that.
Then we've also got a couple of questions about what role allies have to play when there's lateral violence.
Yeah, that's a very good question, because it does happen at many tables where there is lateral violence. I think that there's so much hurt and so much mistrust by Indigenous people that it's very, very hard to allow other people into those circles because of the learnings that we've had about giving people trust and then being treated in a manner where where our trust is broken. And I think that is a very difficult issue for all of us, but it is a difficult issue for Indigenous people, Indigenous patients. Trusting is a very hard thing to do.
You didn't sell it to them.
Yeah. Oh, just a minute. Hi, everyone. So just a note that we also have a couple of notes. Just wondering about resources or readings that you might recommend. I know, Keenan, you had some lists there, but I'm wondering if there's anything you'd recommend, and also maybe if there's some stuff with the diversity inclusion training that's been offered and the new report that's out today.
Yeah, there's a number of recommendations or lists. So there's a number of new films that have come out. So there's a whole list of films that are helpful. There's a new film, and it's called it's by Tanis or Danis. Sorry. I'm blanking out, but it is a modern day depiction of residential school night raiders, and I think it's going to be in the theaters October 8th. So it's a modern day kind of a sci-fi view of what it's like to be a mother losing your child to that. I see Nadine has put up a list of all the resources that we can access, but there's a whole list of books that have been written, a number of even children's books that have been released. And I don't have the titles for you now, but we could probably find the books, the films, the papers that are really helpful in learning.
So Esther, there's a question in the chat. Do you have strategies to avoid tokenism within AHS to ensure appropriate representation from the Indigenous Wellness Core on projects or initiatives?
Well, you know, that's a difficult subject because, as you know, we are trying to get more and more Indigenous people into the health careers and health fields. So in many places, anybody who, any Indigenous person who is a physician, a nurse, a paramedic, an administrator, somebody who knows public health, all of those people are being grabbed up by organizations. So any organization will have a very limited number of Indigenous staff members, and so it is very difficult to you know, to recognize tokenism. But what is the bottom line in tokenism is that the person who is in that position needs to be heard and needs to be listened to at the decision-making tables. They need to be part of the decision-making and not just upheld as a token.
Thanks. There's another question from the chat. What do you say to people who feel overwhelmed by the terrible history of residential schools, but feel as a non-Indigenous person that it feels disingenuous to take on the sadness as the trauma is not theirs, and the quotations, imposter syndrome?
Yeah, it's really difficult because I think people, I mean, we all are, every human being is raised to show compassion, and sometimes, you know, you just don't feel the compassion of the moment. Maybe it's not the right learning situation, or many people have not experienced the levels of trauma that we see, not only in Indigenous people, but in situations across the world, war situations, you know, the Holocaust, and currently what's happening in Afghanistan. So many people have experiences of trauma, and they can easily empathize or have compassion for others, but it's very hard to understand that level of trauma if you've never experienced it. I think the genuineness of that is very difficult, because if you have not had that experience, it's hard to be genuine. But certainly the act of showing compassion is important.
Mhm. And there's another question from the chat. What would you see as the key to building healthy relationships as an ally, and how do we repair relationships if we made a misstep?
I think the main thing is, and Marty, we hear it from when we have our meetings all the time, is listening. And as we went through this exercise, listening is the first thing. And are you hearing? Like, are you hearing what this person is actually saying? And it takes a thought process to understand, you know, where this is coming from and why it's important just to listen. And how does that impact your thought process?
Actually, we had a note as well from Marnie Pernas about some of the new allyship training. Would it be all right if I invited Marnie to come off mute just to share a bit about that?
Mhm.
Thank you so much, Carolyn, and thank you so much, Dr. Tailfeathers. Just an incredible session today, and a remarkable day of learning and reflection for all of us. I know I and my colleagues have been immersed in this. Today is an absolutely perfect day to launch the report and recommendations of the Anti-Racism Advisory Group, which was chaired by our colleague Nadine, and Marty and Randall played a pivotal role in that work that was led by Indigenous, Black, people of color, Jewish people across the organization over the course of this last year. And really, the 36 recommendations address the so many of the systemic issues that you and so many have talked about today. So it is posted. It is on your chat box. It is going to be posted externally tomorrow as well. So watch for some stories about this really, really important work. And the other piece, because we're talking about allyship right now, is such an incredible point. A lot of our work through this last year is how can I be an ally? How can I stand up and speak out? We're asking people to do that. How do I do that? And so on to augment your incredible session today, Dr. Tailfeathers, we launched an e-learning module in July of this year on My Learning Link for allyship for everybody. Anybody can take it. It's e-learning that's available to absolutely everybody. And then just last month launched a second part to the allyship course, Allyship B, which is specific for leaders and how leaders can be allies to move from allyship to bystanders. And so we can create a culture where we truly do stand up for each other, speak out against racism and intolerance, and support each other. And sometimes that standing up and speaking out might be just checking in with the person who is targeted. And so we encourage all of you to participate and take these e-learning modules. Thanks again for the opportunity.
Thanks, Marnie.
Thanks, Marty. And we have
Nice to see you.
within the Indigenous Cultural Sensitivity Program, a module that was developed within the Indigenous Wellness course. Well, I was wondering if Sandra can speak to the module that she developed on allyship as well. Not to put you on the spot, but if I could put you on the spot, that would be good. Are you there, Sandra?
I don't think we have her here today.
Hi, Marty. Yes, I am. I apologize.
Okay.
It's hard. Don't put you on the spot.
Thanks, Sandra.
You're welcome. I think the presentation today was fantastic. Thank you so much, Dr. Tailfeathers, for that. I really love seeing your take on allyship, and I really enjoyed doing some research on my own and creating a course as well. And I think one of the main things that I really took away from my research was the apprehensions that people have when they're delving into allyship, and really those kind of those top 3 main apprehensions always kind of came back as they're scared they will say or do the wrong thing. They're scared that maybe this work isn't for them because they're not Indigenous. And also the other one was they're apprehensive because they may not have the knowledge. So sometimes allies think the prerequisite for being an ally is they have to ascertain a certain level of education. And really, you don't have to if you start into allyship from a place of the heart, because when you're working with the Indigenous community, allyship really is the work of the heart. And if you come at it from a place of being from the heart and a place of education, a place of learning, then it's okay. You're going to do and say the wrong thing sometimes. We all do, like all the time, and that's okay. You're coming from a place of education, a place of learning, a place of knowledge, and that's how you begin your journey.
Thanks, Sandra.
You're welcome.
Dr. Tailfeathers, I'd like to thank you for your time and your presentation today. And I want to thank everyone for their time and attention and coming to this presentation. We are going to be doing back-to-back presentations, so we do have a couple of minutes for everyone to do a quick break before the next session begins. And so we'll see you in a few minutes. Thanks, everybody.